everybody, Dr. Mattingly here. So today I want to go over some more information with you in regards to chiropractic care and your shoulder. In a previous video, I covered some of the basic muscles of the shoulder, which includes the sits muscles. The supraspinatus sits up here, the infraspinatus down here, teres minor, subscapularis, which sits in front of the shoulder blade itself, the deltoid, which covers the shoulder or the arm, and the nerve supply from your neck, C5, C6 area. So let's cover some of the bones here. We've got the clavicle, or also known as the collarbone, which sits right here. You have the scapula, also known as the shoulder blade, which is right back here. You have the humerus, or the arm bone, which of course is here. And then you have the sternum, or the breastbone, which sits right here. So those are the four bones that involve the shoulder. Now the joints that make up the shoulder are the sternoclavicular joint, also known as the SC joint, and that sits right here. That's the joint between the sternum and the collarbone. Then you have the acromioclavicular joint, which sits out here. It's also known as the AC joint. This is where shoulder separations can occur, where the actual the clavicle will actually separate and move away from the acromion process as part of which is part of the scapula. All right. Then you have the glenohumeral joint, which is the arm bone, sits in a kind of a half cup of the kind of the end of the shoulder blade itself. So that's the glenohumeral joint. And then you have the scapulothoracic joint, which is more of a kind of a muscle gliding joint. It's not a joint in the true sense that it has a capsule that surrounds it. So it's not like the glenohumeral or the sternoclavicular or the AC joint, but it has some of the same qualities because there's some movement that happens with the scapula in regards to movement on the thoracic, the rib cage, right? Just in regards to this movement here, the arm bone and this glenohumeral joint moves at about a 2-to-1 ratio of the scapula itself. So for every 2 bits of motion here, you have 1 bit of motion here. So there's a much greater amount of range of motion that comes from the arm bone, the glenohumeral joint, as opposed to this scapulothoracic joint. All right, so these joints can all have something go wrong with them that can cause problems with the range of motion in the shoulder. So that's where chiropractic care and pressure point therapy care comes in. So if you're having some problems with your range of motion of your shoulder, or you know somebody that has some problems with the range of motion with that shoulder, they're going to need some chiropractic care and some pressure point therapy. So, our contact data is below. If you have some problems with your shoulder, tell me on your next visit. If you know somebody that has some problems with their shoulder, share this video with them so that they can take a look at it and see that, yeah, maybe my problem can be helped with some chiropractic care, okay? So again, our contact data is below, and I look forward to seeing you in the office soon. Thanks.